All the board of commissioners back to order, and we're on item 5, individual delegation wish to address the board. No. Matters of interest to commissioners.
I just have, at our last meeting, we talked about some of the debris and the trash on the highway. And I think, Mr. Chair, you talked about you had gotten a call. Well, I received a letter and, from a concerned citizen concerning the litter on Blaine County roads. I had the time, and my husband had the opportunity to drive me on a couple of those roads. I said to look at them. And he was correct. It is unfortunately, we have a lot of litter on our county roads. And I think we need to do some type of campaign or something to encourage our citizens and those who visit Blaine County to dispose of their trash in the proper receptacles, but not on our highway. Because we have a beautiful county and we want to keep it that way. So I want that person to know that, yes, I did take a look. And
Yeah.
thank you.
Yep, thank you. I think we all got that letter.
Yes, I
We're
appreciate
all
it.
going to talk about that at our little short retreat, 1st of February. God, Dale?
I got a couple of things. One is, on that litter issue, I was noticing that you don't see the signs up posted that's saying littering is a fine. You don't see many of those. I don't know what you call DOT on that, like they talk about the
We're
road.
going to discuss that in February.
Okay. And the other thing that I want to talk about was, at one time I asked Mr. Morton if he could present to us some information about that cleanup crew that's on the highway, now it's coming out of the sheriff department.
That's going to be presented in February.
That's in February too. Okay.
And any ideas or suggestions you got, bring them with you.
Mr. Chairman, I'd like, one item on the, retreat, agenda item, equal opportunity and affirmative action. This for employment in Blaine County.
If you'll send Mr. Martin an email, he'll add that to the agenda. Anyone else?
One last thing would be, I know a date, we set a date on the time that we're gonna have it on February the 5th. Is that date set in stone, or can we alter that date?
It's up to the board. It's set in stone right now. It's up to the board.
Cause I won't be able to make it. I know I got an emergency situation I have to take care of on the 5th. I know something I cannot make, and I would love to be there with everybody. And I was talking to Mr. Martin, he said he would be gone that Wednesday and Thursday. So he said maybe that following week.
We'll talk about that under Mr. Martin's.
Okay, we get some, all right,
That's okay. We'll get to it a little bit. Okay, I give time to people to think about it, be looking at the calendar. With the approval of the board, I'd love to ask Mr. Martin to send a letter to DOT and tell them we totally disagreed with their plannings around Blaine County's roads. I think they'd moved 87 and widen out to 2026, Danny.
I'll give you information tomorrow, and, I think it said 2026.
Yeah.
Because at first it was 2019, wasn't it?
So,
I don't get everything tomorrow.
if that's okay with the board, Daniel can get the information to Greg, and Greg can go ahead and prepare the letter, if that's okay.
That was saying we disagree with that.
But it's not acceptable to us.
Right.
Okay. Anything else? Item 7, Health and Human Service Agency, Mr. Wayne. Now,
Thank you, Mr. Chairman.
and Mr. Wayne, I know that your time is short here, and as chairman and as a health board advisory board member, I thank you from the bottom of my heart, and as the commissioners do also. You've come in and you bailed us out, you've done a superb job. It's a shame you couldn't stay, but I understand. So just in case we commissioners don't see you tomorrow, thank you from the bottom of my heart.
Well, thank you very much. It's been a pleasure and honor to serve here, the citizens of Blaine County, and I appreciate your comments on that. Thank you, sir.
Stay loose, just kept me.
Yeah, when did you get back?
I'm gonna be a few weeks during the transition and changeover. It's not gonna be here February the 4th, and maybe anywhere from 2 to 4 weeks after that. But I'll have fewer hours on into February. I'm thinking maybe here, maybe in February.
Maybe we can do something.
Yeah,
I just didn't want to miss the opportunity in case you didn't make another board meeting.
Thank you for your
Okay.
service.
Thank you, appreciate it.
And if you do, give them appreciation or something.
The Health Department has one item, 7A tonight, and it's really the bylaws, operating procedures for the Health and Human Services Advisory Committee. Request your approval for that, and this document, really nothing changed there other than updating the date that it was reviewed.
Motion
Offer
to-
motion to approve.
Motion by Mr. Cardell, second by Mr. Bullock. Any discussion? All in favor, say aye.
Aye.
All opposed? Thank you, sir. Ms. Renee Davis, consider accepting or declining a bid.
One more item.
Oh, I'm sorry, Renee. Updating the garden, okay.
Okay,
How'd you come that was a little further down?
That's fine, that's fine. Thank you, Mr. Chairman. I'd like to ask the staff that I asked to attend to come forward, if they please come stand with me. I'm gonna go through this rather quickly. It's quite a bit, but I promise to work my way through it. I wanted to be able to do this, okay, yes, sir.
Say still.
Oh, okay.
Let,
Okay.
that'd be a better picture.
Okay. So anyway, I really appreciate you allowing me time on the agenda tonight, and I'd like to share some highlights of what all three agencies that serve under the Health and Human Services Department do. And this is really, believe it or not, it's fairly voluminous, but I'm gonna be quick, and we're not gonna talk about, I'm in my 45th year in public health at the federal, state, and local level, and I've been here 14 months this time, since November 2017, and I was here 3 years ago for a stint of about 7 months. So as my tenure comes to a close, I wanted to take this opportunity really to sort of speed through a few things from every department, aging, Department of Social Services, and health, and it is statistics, so you might glaze over after about 7 or 8 of these, but anyway, I wanted to have this opportunity to recognize a few of the staff. I wish all 150 some of them could have been here, but it's been pretty packed. But in Division of Aging, Kelly's provided information on BARTs and so on. There's been over 5,000 home delivered or frozen meals served, 21,000 congregate meals served, 5201 hours of in-home aid services provided, $16,187 spent for housing and home improvement projects like ramps and so on. Over 2,000 medical transportation trips for like doctor's appointments, 16,725 general transportation trips provided, paying bills and that sort of thing. That's fiscal 17-18, and so far in fiscal year 2019, there's been over 2,400 home delivered frozen meals, 7,700 congregate meals, 2,600 hours of in-home aid services provided, over $10,000 spent for housing and home improvement projects, 776 medical transportation trips, and over 5,900 general transportation trips. Also, during the Medicaid Part D open enrollment from October 15th through December the 7th, the State Health Insurance Program, SHIP, counselors assisted a total of 80 seniors with finding the best drug plan for their needs. And lastly, the Dementia Friends Initiative for Bladen County has held 5 information sessions with a total of 63 participants pledging to do their part in creating a dementia-friendly communities by becoming a dementia friend. In the Department of Social Services and the Food and Nutrition Services, food stamps, over $9.3 million in food stamps administered, and they have inactive cases of over 44,235. During Hurricane Florence, the emergency food stamps administered $3.4 million during that crisis period, for a total of 13,522 households served. In Medicaid, family and children, we served over 4,000. Adult Medicaid served over 4,300. Workforce served 133. The energy programs, crisis intervention program, the light bills and so on, served over 1,000 citizens. Low-income energy assistance program, LEAP, served 644. In the adult services, investigated 79 reports, guardianship cases, which can be very difficult and labor-intensive, were 29 of those, and monitored 11 facilities. In Child Protective Services, they investigated 386 reports, and in foster care, child care, 43. And another area that we wanted to mention here was total child support collected was over $3.5 million, which is really goes back to the economy of the county for those child support collections. We've talked a lot about in our department head meetings about some of the threats to the county, like Gen X and hog farm lawsuits and White Lake. Then along came Hurricane Florence, and we had hundreds of hours in the EOC along with our other colleagues and departments as well. We've been participating in the opioid work group, struggling to fill vacancies, working on that. And then Medicaid transformation is going to be, it's very complex, and it's coming pretty fast. And this summer, I guess my replacement had to deal with that. We've also had extended clinic hours at the request of our client surveys that we do through the health department. And I mentioned 94% of our 2-year-olds have been adequately immunized. Also, we've got about 98% school immunization levels. So the immunization staff, the clinic staff should be commended for that. And we were able to get a $16,700 rural health grant to modify we modified the original intent of that to get some clinic renovations, some way overdue clinic renovations. We've completed the community health assessment and submission of evidence for reaccreditation. We've gotten that completed. Site visitors will be here February 28th and March 1st for sort of like hospital accreditation. They'll be here to do a walkthrough and sort of analyze everything we do, all of our policies and procedures. Our WIC participation remains over 100% plus caseload served, and we secured funding for scanning our medical records to get rid of our paper and clutter so we can create some office space, and maybe as we write and get the grants successfully, we'll have a place for hopefully some positions or part-time positions to administer those. The health department administers approximately $865,000 in aid to county funding from the state every year through the contract addendum process. We distributed mosquito dunks to Bladen County residents in the aftermath of Hurricane Florence. Environmental health staff and emergency management and others in this room also sprayed the county 3 times to lessen the impact of mosquitoes. And we received additional funds for ongoing mosquito abatement, which I don't think we actually used at all, but we really get that opportunity. We see between 5,000 and 6,000 visits at the health department each year in our family planning, maternity, child health, TB clinic, communicable disease, and immunizations. We have Safe Kids program, child passenger safety technicians. We have 9 of those now, some of EMS, fire department, and the health department. We have a new childbirth educator to begin childbirth classes this spring, and we have a new partnership between the Bladen County Health Department and join faith-based organizations to form a long-term disaster recovery team whose mission is to assist individuals, families, and groups impacted by a disaster in the recovery process. Bladen County staff, CAP staff, in our CAP program demonstrated a positive trend in decreasing the amount of local appropriation required to run the program over the past few years. This year being sort of a landmark year in that it's only 8.32% of the contributions for the CAP program were required this time. Some of the things that we're looking at in the future, and I'll pass it on to my successor, is to maybe establish a federally qualified healthcare center, a 501c3, that would help maximize revenues and generate income as well. We're pursuing and been looking into treatment and counseling for opioid addiction through our opioid task force or working group. We're looking at the possibility of an express clinic where clients can come in and we can speed them through just getting a blood pressure read or TB skin test or getting one read, vaccines, immunizations, that sort of thing. So we also want to continue to improve health outcomes through the strategic plan. And one of the latest things on this is going to be, it looks like lots of money available for possibly dental care for pregnant women. That's a few things for the future. And so, you know, no one's to blame for the problems facing children and families these days. But we all share part of the responsibility for making things better. That's all for unknown. I really like that. Thank you all for giving me the time to do that. I have Haven't taken up a lot of your time just the past 12, 14 months, so I guess I did this time. You didn't want to take back any of that thing you said a while ago.
No, I need to add more to it.
But thank you, I tell you, these are working people, they work hard, and I've always said, that public service and public health is pretty important as much a calling as it is a vocation. No one ever intentionally got into it that I know of to get rich, but that's where their heart is, serving people, and this is just a small number of folks that do it each and every day. So, I just wanted to publicly thank them, and thank you so much for your time, and thanks for the staff coming and putting up
Mr. Martin.
Hey, before you leave, please tell your employees that we said thank you. That's all we do.
Yes, sir, actually, I have a meeting tomorrow.
That's her name.
On the agenda this evening, a bid was placed on January 14th for a property at 785 Barney Toe Road, which was foreclosed by the county. And the bid was for $1,500. The estimate to the county was $6,400. And, at this moment, Mr. Toe has some explanation on why he did it for $1,500.
Let's go.
Mr. Toe?
Yes, I'm Charles. Well, I'm here tonight to place a $1,500 bid on a piece of property in the Layton community, roughly about 4/10 of an acre, and it's land of my uncle's estate, and it's no good for building because it's right in the flood zone. And it's too small. The guy that owned it, he tried to put a trail in it, but it was too close to my property line, but run his sewage line. So I think he abandoned his trail. And there's 75 trailers on it, but it's no good. It is 4/10 of an acre property, no sewer, nothing is on the property. In a flood zone. In Little Lagoon, North Carolina.
So, we're here, y'all are either to approve or deny the bid, of $1,500 so that I may go forward if you approve it to go
Mr. Chairman,
to accept the bid.
when was the last evaluation done on this property?
About 2 years ago, when it went into foreclosure, we went and, the appraiser went and checked it out, and, cause it was at 21,000. And before revaluation, it was 21,200. And then reevaluation, 2015, it was 20,680. And then when our appraiser went out about 2 years ago, I think it was this late 2016, the mobile home is still there, but he put a zero value to it because it's so demolished.
And the 4/10 of an acre is worth $6,400?
It's as a buildable lot. That's what the rate is in that area for a buildable lot.
So you build on 4/10 of an acre.
Hey, question, he said it was flooded,
It's in the flood zone,
it's in the flood zone,
correct.
and I guess during Florence and July, it flooded.
It was underwater.
So I thought, Greg Elkins, somebody had moved that, things out there about flood areas.
Well, let me ask that, what the reason there's $6,400 on it, is that right?
The value of the property,
Hold on, how much the county got invested in it?
the county has invested, $6,400.
So the reason it's $6,400, whoever put that trailer on there should have been appealing it to the tax office so that the taxes would have been lowered. It's up to the landowner to appeal his taxes. And that's the reason it's as high as it is.
But the trailer, am I saying, you saying the trailer been condemned?
I'm talking about the reason it's $6,400 that the county has invested in it is because at one time it was valued at $21,000. And it's up to the tax owner to appeal it if it's not worth it, or if it can't perk and things like that, because we have no way of knowing that. So the county's got $6,400 in it. And the only thing about you being family, if you wanted to pay the $6,400, it becomes yours. It don't have to be bidded out. We take it off it goes back to the family, but the county needs to get their $6,400 in back taxes. No matter what it's worth now, we got $6,400 in it.
That's the question I asked, is this for the attorney, it was in foreclosure, did it go through the foreclosure process?
Yes.
So these attorney fees and all the legal fees and everything?
Yeah,
is
the
included?
majority is the tax amount, plus the attorney fees, clerk of court, advertising, different kind of fees, and it includes that, that's all included in that $6,400.
But the value of the lot itself at this
But the
point in time-
value of the lot, as we speak right now, is $6,040.
That's not including attorney fees, that is the value
That's
of the
just
lot.
the value as it is today.
That's
And
the tax value.
we got $6,400 in it right now through legal fees and foreclosure costs and all that, that's what you're saying.
The taxes,
And taxes and foreclosure and cost of foreclosure.
But the actual value of the land is $6,000
yeah, that's what we're looking at today.
for 4/10 of an acre.
And remember, that's in the county's name, so I mean, whoever the new owner would be, they would need to go through the appeal process. But what the county has invested is the $6,400, and that has nothing to do with the value of the property right now. Because that value of the property is gonna be whoever the new owner is, they'll be able to appeal the property, during that process.
Can I ask you a question? A little while back, last meeting, Mr. Evans came in a couple weeks ago, and we talked about reassessing property and the condemnation of certain properties because of flood. Does this piece of property meet that same criteria, that it falls in that category, where where he can go out and reassess it and say that this property falls in that zone where you can't build anything in it, you can't insure it? I'm asking, is this piece of property in that same outline fixed? That's what I'm asking.
I'm not sure because his was he was notifying certain taxpayers, right?
That's correct. Whose
And-
whose actual homes were damaged,
Yeah.
whereas this is more related to the value of the lot.
Well, I think, Mr. Cogdill, Renee answered your question. Whoever buys the land appeals the land price, and then it's reevaluated. The $6,400 is back taxes and lawyer fees. That has nothing to do with the price of land today. That's the back taxes and the legal fees.
So what I'm asking, to make sure I'm understanding, we said the lot is valued at how much today? $6,400, right?
$6,400.
Okay, and we got $6,400 and how much into legal fees?
$6,400,
In the legal fees?
right, and the land, and the back taxes.
And the back taxes, that's the taxes back value, so
Yeah.
the value. So we're not collecting attorney fees, which one are we collecting? Letting him take the property, or we collecting attorney fees?
We collect it all.
Foreclosures, which one are we doing?
Just disregard that the value is $6,040, okay? The $6,400 is what the county invested in it, which was back taxes for years, I think it was for 8 to 10 years. Plus any legal fees that was included during the foreclosure process. But the majority of it was the tax amount, which included at that time a mobile home and the land. So you can look at $380 to $400 in 2013 and back, that amount of taxes plus any legal fees.
The question last night is, Mr. Cole, did you or anyone that owned that property receive notice of foreclosure?
Mr. Dakota on the.
I don't know.
I'm asking, but did anyone know it was in foreclosure? It was going through that process?
Yes, I knew it was in foreclosure, and I called Mr. Howard to make him an offer, but he declined.
So if he, make sure now, Mr. What I'm saying is that for $6,400, everything go away, he owns the property. That's the way it would have to be fixed.
6,400 would be the least amount
That we
that
want.
he would get on.
So your recommendation is that we get $6,400? That's your recommendation?
Well, I
That's what
can't,
I do.
yeah, I can't recommend, cause that's just the board. I only take the bid process because I'm the assessor. But whatever the person comes to me and bids, I have to present it to you, whether it's $75 or I can tell him 6,400, but I can't approve or recommend anything.
What's the pleasure of the board? What's the pleasure of the board?
Motion to deny?
Motion by Mr. Gooden, deny, seconded by. Motion dies on the floor, lack of second.
Next item, sir.
Well,
Is there another motion? Motion table?
I make a motion that we reassess, my motion is, I'm just trying to figure out, I'm trying to figure with the value of the property, that, I don't know, if that would work either, if we recess it, it's not gonna make any difference to $6,400.
Motion by table, Mr. Dawes, second by Mr. Tready, any discussion? All in favor say aye. Aye. We'll bring it up another meeting, Mr. Crowe. Thank you for coming.
Thank you.
We'll add it to the agenda next time. Finance Department, Ms. Lisa Cohen.
Sorry, the week was already completed half of the fiscal year, but I will review the December dashboard with you. The revenues we collected for the general fund were 48.05%, and the expenditures were 43.52%. The solid waste fund, we collected 63.26% and spent 46.58%. Emergency telephone, we collected 26.47% and expended 31.59%. Water, we collected 51.93% and spent 23.95%. Any questions?
One person pertaining to something, I don't know what I'm asking at the right time. But when you may be the answer, maybe, I may need to direct it to Mr. Martin, but on the jail facility, detention facility, we know that that facility is generating an outside resource from the state, right? Because the inmates come in. How are those resources handled? Do they come through you, or where do they go?
They come into the general fund, and they're to help offset the employees and the expenses for food and inmate medical that we have to provide for those misdemeanor programs.
So if we have any money over, does it go toward the loan?
If it had any money over, it would go
But
to the
what I'm
loan.
asking, we at one time talked about
Yes, sir.
that would be a way to deal with the loan.
But right now, they've cut our numbers back, and Jeff, if that's correct, is that not correct? Our numbers are still down from what we projected?
They're down, but they're working on getting it back up.
Okay, so, but when it gets to a certain point, what I'm asking, do you handle that money, the sheriff department house, who handles the money, who would it come to, the deal with it, to disperse it?
It'll come to the budget, and then we'll have to work at it with the sheriff.
So then he'll come in.
It's a budgeted, it is a, like Lisa's saying, it's a budgeted revenue source.
Mhm.
And you recall that we added several jailer positions, and there's food and, medical expenses to pay associated with those state inmates. So, we haven't gotten to, like you're saying, we haven't gotten to the point that our revenue is exceeding our expenses.
Okay, that was the only thing, I know we're doing it, and I'm just trying to figure out where we at with that scenario. Are we getting to a point that can start helping to pay and generate?
We hope that it will. There's working on some, options that may in fact do that, but that hasn't happened at this point.
But when it comes to that point, we all influence things,
Certainly.
that profitability point where it's turning money over to different.
Yes, sir. We'll be glad to share that news.
Yeah, the question is, so, cause I think we brought, you said more employees in?
Yes, ma'am.
So, what's the ratio for, like, we expected to receive a certain amount? How much are we getting, what percentage of that are we really getting?
We're about, we got 337 budgeted, I think it was, and we've collected like 137,000
Yeah.
so
And
far.
so we
That's
operate in
through
the red.
November.
Currently,
That's through November.
so currently we're in the red.
Well, it depends on what we've spent as well, because we haven't had to pay out as much food and inmate medical, because we don't have those inmates in the facility.
Mm-hmm.
The only thing we are expending would be the jailer positions, the detention office that we have.
So as we pick up population, the jails would also increase too, right? So that means we have to increase jails, Jeff, that cost still keep going up?
Not
We
necessarily.
hope we're getting close to the point that, the scale that we can handle additional inmates without additional staff.
Okay, that's what I'm saying. What I'm saying, are we gonna ever get to a point where it's gonna be, are we getting close to that point? That's what I was asking. That's what I'm saying.
That's a good discussion, but we probably need the sheriff here to talk about that.
Yeah.
Yeah, that's what I was talking
I'm through, but Gene asked me to do his part, he had to leave,
Okay, next item, consider approving a change order, the amount of $74.50 to Scott Cumby, the Bryant Swamp.
according to his note here, he said he found additional debris at the lower water levels, so he'd like for an increase of $7,450.
Pleasure
So
of the
moved.
board.
Motion to approve.
Motion by Mr. Cogdell, second by Mr. Good, any
I
discussion?
have a question. I think we asked that question before with another company. We had to do that once so this is a different.
This is a different one. This is for the Bryant Swamp Canal.
Okay. And, I know he's not here, but I would like to find out though, because on all of those, streams and branch, was as the water, drying up, you wouldn't see a whole lot. So do we expect, and do we have the extra money to support that?
I could say on behalf of this one, but this is one thing me and Maria talked about, because I've got it identified by different areas. There is enough money to cover this $7,450.
Thank you.
Okay.
That's it, that's the kid.
I could say that for that one.
Thank you.
And I asked Dean last time he was here, when the water starts flowing, and he said that they were gonna go back through there again and make sure they had all that out once the water low. You know, so that was his comment.
Good to see it.
Yeah, he said they would go back.
Right now, a lot of the contracts have come in under what was budgeted.
Oh, yes, sir.
Okay,
Thank you.
thank you. Advisory board appointment, adult health care, adult care home community advisory committee.
Reappoint Ms. Sandra Guines and Ethel Davis.
Motion by Mr. Cogdell, second by Dr. O.T. Moon. Any discussion? All in favor say aye.
Aye.
All opposed? Airport appeal board.
Reappoint.
Reappoint by Mr. Good, second by Mr. Trivett. Any discussion? All in favor say aye. All opposed? State Relay Fire Service Committee 2.
Want Clark Valentine and Byron Mays.
Second by, a motion by Mr. Dow, second by Mr. Trivett. Any discussion? All in favor say aye.
Aye.
All opposed? Health and Human Service Advisor Council, that is, recommendation Tiffany Pate. Motion by Mr. Cogdell, and second by Ms. Trivett. Any discussion? All in favor say aye.
Aye.
All opposed? Lisbon Rural Fire Protection District Commission.
Report.
Motion to reappoint by Mr. Good, and second by Dr. O.T. Moon. Any discussion? All in favor say aye.
Aye.
Lumber Workforce Development Board, that would be Dr. Amanda Lee, the new president of the community college.
Motion to approve.
Motion by Dr. O. T. Montgomery, second by Mr. Cogdell. Any discussion? All in favor say aye.
Aye.
Next month, February the 18th. That's the second meeting, ain't it? Yeah.
Yes, sir.
Blaine Community College Board of Trustees, Child Fatality Prevention Board, Lumber River Council of Government Region, and Aging Advisory Board, there's 6 there, and Nursing Home Advisory Committee.
Can I ask a question on this piece? On the one with the Blaine Community College Board, is that has to be just someone from the community, or could it be elected official, or is that some, I know Miss Knight has gotten off of it.
Well, normally, whatever the board decides to do.
Okay, I was trying
Normally,
to
don't
figure
have
out.
a one elected official on it.
I'm just asking, with that people, I know Barbara's coming on.
Okay, 13 is county manager calendar.
Thank you, Mr. Chairman. I'd like to review the calendar for the remainder of January and February. Point out that, on Saturday, Saturday the 26th, which is this Saturday, at 6 p.m., the Blaine County Fire Association Appreciation Dinner will be held at the FFA camp at White Lake, and you all are invited to attend that. On Tuesday, the 29th, at 10 a.m., there is an advanced opioid training session that will be hosted by East Point, and that will be held at Blaine Community College. Also that day at 1:30, there's a recovery community messaging training session that will also be held at Blaine Community College, and it's related to opioid as well. Moving over to February, on Monday the 4th at 8 a.m., there's a prayer service here. That evening, the board meets at 6:30. On Tuesday the 5th at 10 a.m., there's the planning session, and I know there was just discussion about.
Yeah, let's talk about that, Mr. Martin.
Change
What,
that.
what's the pleasure of the board? Leave it or move it?
I'll make a recommendation, we move it to support all board.
I make a motion to remove to the following Tuesday, at the same time.
Well, let's calendars.
I know, Mr. Chairman, I know we have the opioid session that day,
Okay.
and we have a doctor coming from Chapel Hill,
What time is it open on?
at 2 p.m.
What about that Wednesday,
13?
The sixth,
13th?
or that because you're gonna be gone.
No,
So that week is just out.
The
then.
13th, I'm talking about the
You
13th.
gone the whole week?
No, no.
What about the 6th?
That's Mr. Martin.
Mr.
Yeah.
Martin.
I can't, I was just telling, they said that the Smithfield thing is on Thursday, and I was like, well, I'm supposed, when they were just telling me, I was like, I'm supposed to.
Okay.
Oh, yeah, that's.
I mean, I don't have to, I just have a session in Winston-Salem.
That's okay. I forgot.
You said 13th?
I'm looking at the 13th.
13th is out, is that out?
That's fine with me.
I was saying 13th at the same time.
And we're 13th.
February 13th.
I mean, February.
About, can you have that was
That
February
works for
13th?
me, I don't have anything
Well,
on that
what-
day that I can't.
What time, hold on, I have,
We start at 10.
oh, I got an appointment. What, can we do it at 11? That's not what the rooms are not. On the 13th.
Let's not do it that
I
day.
can't choose one.
What's the 14th, but that Valentine's Day?
14th.
Good day.
Last time, good day,
Hold on,
me.
hold on a minute, hold on.
What about the 11th?
I can do it on that anytime.
Yeah, it's good.
That was good with me. Everybody good that month?
That's February, right?
I can do it.
Good check.
And the two, okay.
February, you said February the 11th?
February 11th.
Yeah, you're going to, on the 11th.
We got to meet, we can't push it out of February though.
I'm gonna go, I'll reschedule my appointment.
What you say?
I can do it, but I have to be gone by 11 at 1:30.
February 11th. That's
Yeah,
all.
I can do it, I'm gone by 1:30.
We might not be through.
Well, it does not do it now.
What
What
was the
about
6th? You couldn't make
the-
the 6th, right?
What about
I mean, I can if I need to.
What about the ninth, that's the Tuesday after our meeting,
February 11th?
February the 19th?
Was the 13th, good or bad?
Everybody was
That
good to
I
go,
thought,
except you.
except for you.
Except you.
No, mine's on the 14th.
So we
Oh.
can
I
do
think
the
it's
13th.
Valentine's, sorry.
No,
So 13th is good.
13th.
Yeah, I can do the 13th.
The 13th.
I can't do the 14th.
does that work for,
The 13th work?
It's a
Yeah,
Wednesday.
13th.
works for me?
I sure appreciate
Motion by
it.
Mr. Cogdell, second by
Second.
Mr. Bullock, any discussion?
13th, at what time?
10 o'clock.
Same exact schedule, just a different day, correct?
Mr. Chairman, we had it had the Jones Lake area, the meeting area there reserved. I'll double check on that date and confirm with you.
Okay.
Where?
Jones Lake
Jones
State
Lake.
Park on 242.
All right, thank you, Mr. Martin.
Thank you.
13th.
Okay. Moving on with the calendar, on Monday, the 11th at 5:30 PM, the Health and Human Services Advisory Committee meets. The Board of Commissioners meets on the 18th at 6:30 PM. Also, I did want to remind you that Smithfield is having a grand opening or ribbon cutting type ceremony on Thursday, the 7th, that I think you all are invited to. Also, on Saturday, the 23rd at 6:30 PM, the Blaine County Hospital Foundation Gathering will be held at Moon Hill.
Mr. Martin,
Yes, sir.
you mentioned Jones Lake, but on the actual calendar, got White Lake.
It's John Wayne.
Okay, we talked about White Lake one time, we found out they don't have, there was an issue there, so we.
So it is Jones Lake?
Yes, sir. Thank you for pointing that out.
Thanks, sir.
If there are no other questions about the calendar, moving to item B. As we've done in recent years, we have, would like to schedule a pre-budget hearing for February the 18th during the regular meeting at 6:30, and also provide an opportunity for the public to share any comments or priorities that they would like to see the county address during the upcoming budget planning time for this upcoming 2019-2020 fiscal year. And this is just very broad and no specifics, just broad, or as specific as anyone wants to be. We don't have any real specific information to share other than just general budget numbers that you can see in that pie chart. But it's just to try to solicit feedback from the public with regard to the upcoming budget. So we could, if the board's in agreement for scheduling a public hearing for the 18th.
A public hearing or pre-budget?
A public hearing, a pre-budget hearing. I mean, just to give the opportunity if anybody wants to come in and make comments to you.
So it'll be a public pre-budget?
Yes, sir.
Okay.
Just like as we've done in recent years.
I just didn't, I thought it was pre-budget for us, not public. Motion by Ms. Trivett, second by
Second.
Dr. Montgomery. Any discussion? All in favor say aye.
Aye.
All opposed? Okay.
Thank you. Item C, I wanted to share with you that the state of North Carolina, the governor, has an initiative known as Hometown Strong, and they are department heads from a dozen or so state-level departments are visiting rural communities, and they would like to come to Bladen County on January 20, or they plan to come to Bladen County on January 29th. They plan to meet with the town of Elizabethtown that morning at 8:30 at the farmer's market, with the county folks at 10 o'clock. Then they plan to attend an economic development meeting that will be held at the winery that day at lunch, and meet with several of the municipalities in the afternoon. So I just wanted to let you know, we look forward to meeting with them. They want to put faces with names and that type of thing as far as trying to increase the communication between counties and local governments in the state. So,
You said the 29th?
yes, sir. I'm pretty sure it's 29. Yes, sir.
Well, you need to
29th
call
of
East
January.
Point William and tell him that when he schedules something now, he needs to come through the county and for him not to schedule it, because that's the opioid mess.
Okay.
And I don't need to miss that.
That's 29th of February,
29th of January.
January?
I mean, it'd be departments, you certainly, if, I don't know that we need to have more than a quorum if any commissioners want to come. You certainly are, welcome to come if you can, but it's really more of a departmental type, department heads meeting with county staff type thing, department heads from the county, so. I just wanted to let you know about it, and I think it's a positive thing that the state's doing, and wanted to share it with you.
My question, when you said it's going to municipalities, which one?
There's a schedule.
E-Town is 8:30.
Elizabethtown at 8:30, and then they're splitting up. I think half of the team is going to Dublin and Tar Heel from 2 until 5, and then the other half is going to White Lake and Clarkton. That's what it says on the
Trunk
thing.
80 and these other small.
I don't know if they've reached out to them and have just had smaller conversations or what, but that's just a schedule we received.
Yeah, can you let me know?
I will. I'll be glad to share.
Can you find out why they're not going? I thought it was all towns.
What about Bladenboro? Bladenboro in there?
I know they've reached out, I know they've had conversation with Bladenboro as well, so I'll find out why that's not on the schedule.
And Tar Heel?
Yeah, I think Tar Heel's on there. Yeah, Tar Heel does.
I won't be able to attend the 29th. I have a summit in Wilmington with the Southeastern Community and Family Service.
Oh, okay, all right, good. Another initiative that is underway is being led by Golden Leaf Foundation and the Rural Center, and that is known as the Homegrown Leaders Initiative. I mentioned to you there was a meeting a month or so ago in Robinson County at the community college. There was a meeting this past Wednesday at Sand Hills Community College in Southern Pines. And it includes officials or representatives from various organizations such as Extension, the community college, the school system, county, from the 10 county Sand Hills region. And it's basically to try to develop leadership in rural communities, and then it ultimately is going to lead, as I understand it, to the next round of grant funding by Golden Leaf. And so, as we continue to learn more, I'll certainly keep you all posted on that as well.
Well,
Yes, sir.
on this hometown and homegrown thing, are they from, you said municipalities, going to something local municipality, are they making the counties eligible to receive any of these funds? Is that gonna be any?
That will, if you
That's what I'm asking,
remember,
because they've been giving it to the town, they won't give it to the county, I'm asking, will we be
Well,
able to get the funding?
the way, and this is preliminary, but the way I understand it, it will be similar to, do you remember the community based grants initiative that's been, they've had 2 rounds so far? The projects came to the county and the county could submit 3, and we submitted one for the airport project, the school system, and I heard the community college this last time. The first time was the school system's laptop, one-to-one initiative. But it's gonna be a similar round to that. The county will have the opportunity to submit 3 or 4 projects from around the county, and,
If we control the money, we have to do it for a county agency or another outside
It-
agency, that's what I'm asking.
the way I'm not sure how that funding happened, if it actually came through the county or it goes directly to the organizations, but I'll find out. But I know the county will have input with regard to the projects that are submitted to Golden Leaf from Bladen County.
I know we don't never get it, because this usually goes to municipalities, a lot of that state grant money doesn't come.
Well, those were just the projects that, it goes to a variety, like I was saying, at the airport, the school system, and the community college were big recipients, with the past 2 initiatives. So, I mean, it should be a positive thing for our community. And Mr. Chairman, that's all I have at this time, thank you.
Individual delegation, Mr. Rush, Commissioner. Well, we're gonna talk about the beavers in February at our retreat. Just so you know. Okay, thank you. You've been here a couple times before, I will share that with you. I entertain a motion to consider closed session in accordance with NCG 143-318.11A5 real property for purpose. Motion by Ms. Trivett.
Second.
Second by Mr. Cogdill. Any discussion? All in favor say aye. Go in closed session.
It's okay, I got Facebook entertainment.
Okay.
I just, where?
But